All right, so here is the left lateral thigh and this large thigh abscess that we're doing. And quickly, we're looking at under ultrasound guidance here. It's a loculated abscess, about 4 centimeters deep based on the ultrasound. So we know it's something we can get to. First thing we're doing is cleaning and really sterilizing that area with a lot of betadine solution. Really clean it up nicely. Here goes the third time. Really get a large area. We see that area I'm touching kind of around just to feel because I kind of lost. There we go. The point of maximum fluctuance right there. And that's where I'm going to inject my lidocaine because eventually that's where I'm going to use my 11 blade to do my first puncture. So here I am making a wheel, and you see the lidocaine making the skin bright a little bit. It makes it a little white there under that betadine. So because it's under such high pressure, it's going to leak out like it does. Sometimes it might just rupture itself, but this is so big. Here I make my first one. You see that white stuff trickling down there? That's a lot of pus. I want to tell you, this was a very juicy one. You will see a little later in this video. I mean, it just kept coming. A lot of it was liquid. I was expecting a lot more pus, but you will see it just keeps coming and coming. And there we go. The dam is loose. So it's been coming out for a while. I squeeze, squeeze, squeeze. You see that indurated skin there? So there's still a lot going on. We're going to have to break up some of these loculations as well and really get in there because it is a loculated abscess that we saw under the ultrasound. So we know just puncturing it is not enough. So here I am with the Q-tip. I'm breaking up loculations. I'm probing, and you can see so much more coming out. Is just insane. I mean, wow. So as you see, I'm putting more and more pressure. It does hurt no matter what. You try to give them as much pain control as possible, as well as local numbing. But once the pressure is relieved, they feel so much better. So you see, I'm just probing it, probing it, probing it, and really trying to break up these loculations. Because the thing about it is, any one of these loculations, if it's left, this abscess can come back. So we don't want that. So there I am with the Kellys, and I'm using that to break them up as well. And really, I don't want this coming back. This guy, I want this a one and done. It's a big abscess. It's been there for a while. And oh God, look at that. Wow. Oh wow. So that's another loculation I broke up. And loculations are little like pus pockets. They're their own little pockets. So you got to break them all up. Here I am. Putting just a lot of pressure on there. And it's still going. I mean, this guy is a big dude, but I was not expecting this to just keep draining the way it did. So here I am, I'm like, all right, let's go for it. Maybe there's more inoculations, and yep, more. At this point, I decided to ultrasound it as well as probe it so I can see what I'm dealing with. And if you compare to the first picture, you can see now I'm dealing with just a lot of crud there, and it's pretty cool to watch watch the probing happen in real time under that ultrasound guidance, but that's what ultrasound's good for as well. So it really does help. So as you can see, I'm just kind of trying to clear it out. It looks like there might be a capsule in there. This could be some kind of cyst as well that got infected. Okay, so I continue. Now I'm looking just kind of further down to see, make sure I'm not missing anything. And again, break, break, break. Pressure, pressure, pressure. More comes. Oh, God. It's still going. There we go again. So here I use the Kelly's again. Okay, so you see I'm really breaking them up, using my finger on the top to put some pressure as well. So break up those loculations, those little pus pockets, and really get them all out of there. And we just keep going. And we got more. And more. All right, so now I decide to use a yank hour and suction the rest of that crud out of there that I can't get out because I saw it under ultrasound. And so that's what I'm doing here. You see all that thick white stuff? I'm pretty sure that's capsule of a cyst. Um, and so that's likely what this was looking back at the ultrasound and everything else. It was an infected cyst. I don't think it was a sebaceous cyst. But who knows? It didn't smell like a sebaceous cyst. I'll tell you that. Those are some of the worst smelling kind of incision drainages you do. But I'll tell you, it wasn't the best smelling. It didn't smell like any perfume, to say the least. But the best thing about it was the results, and look at that white cruddy stuff coming out of there.